think doctors are getting that same kind of respect nowadays?
Unfortunately, not. The things have become much commercialized.
How do you decide who would need an angioplasty and who would need a bypass?
So it is always better to take a second opinion when the decision is not straightforward.
So when a patient comes to you, how do you counsel the patient?
So whenever such patient comes, we have to educate them first and then offer the treatment.
We keep reading about these things, that violence against doctors, isko mara, usko pita, say why did the patient die or why did this go wrong? It becomes difficult later. So I mean, how do you all kind of, as a group, handle these kind of situations?
It is a 50-50 fault on the part of doctors also.
Who needs, what do you mean by this heart failure? Who needs these heart transplants?
Most commonly heart failure with reduced ejection fraction. Most common cause is idiopathic cardiomyopathy.
Are there enough women in your, doctors who are cardiothoracic surgeons?
Entered the field and they are doing phenomenal work.
किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है.
What are the ingredients needed to get a great surgery?
Use of liquid succeed. So that applies for surgery also, that applies for cooking. Basically, it is better than treadmill. Definitely.
Okay, that's a little bit of a controversial statement. I'm sorry, doctor. You are doing surgery, but I'm telling people to avoid surgeries, and this is the way they can do it.
Welcome to another exciting episode of Mystic Talks with Mystic Chords. Today we are thrilled to have a very special guest with us, Dr. Vikas Keshri. He is not only a highly esteemed cardiovascular and thoracic surgeon, but also a dedicated medical professional who has touched countless lives with his expertise and compassion. Dr. Keshri's journey spans years of rigorous training and prestigious achievements in the field of medicine. From AIIMS in New Delhi to acclaimed institutions across Europe, he has honed his skills and earned numerous accolades along the way. In this episode, hosted by the wonderful Dr. Sagorika Mullick, we will explore Dr. Keshri's fascinating career, the world of cutting-edge cardiothoracic surgery, his experiences, challenges, and the passion that drives him to make a difference every day. So sit back, relax, and join us for an inspiring conversation with one of the leading lights in the medical field. And now, without further ado, let's welcome Dr. Vikas Keshri, presented to you by our host Dr. Sagorika Mullick. Enjoy the episode till the very end.
Okay, so Dr. Vikas, whose heart did you break today?
No.
Nobody's? I'm sorry. You are basically a heart surgeon, so you don't break hearts, but you mend them, right? So what was your day like today? Did you have any interesting case?
Yeah, I am what you call in the business of mending hearts, not breaking hearts.
Right.
Thanks to the Almighty and to my teachers and my parents
Right.
who have imparted this skill onto me.
Yes.
So today there was a 54-year-old male. He had a heart attack few weeks back during a bypass operation. So we did a bypass operation in the morning, and he is doing good. Hopefully he will be out of ventilator in few hours.
Oh, great. That's great to know. Once the patient does well, then, as doctors, we are the most happiest people.
That is the biggest gratification we get as doctors.
Absolutely. So I was just going through your website, and I realized that you are associated with the Narayana group, right? So,
Yes.
and then I saw that you are a adult heart surgeon and a pediatric heart surgeon both. So which age group do you normally deal with?
So yeah, I am associated with Narayana Group. So I work in Narayana Super Specialty Hospital at Gurgaon. This is one of the 24 hospitals of our group, which also does open heart surgery. So my training in All India Institute of Medical Sciences was like that we used to operate both on adults and pediatric patients. So by and large, most of the patients are adult patients who have vascular problems like coronary artery diseases or valvular problems. Some of the patients are pediatric patients also who have what the general public calls hole in the heart. So
Hole in the
there
heart,
are
right.
multiple types of hole in heart, ASDs, ventricular septal defect. I don't operate on very small children who are just born 1 month or 2 months or 3 months old. But in general, age group which I have operated in this hospital start from around 6 months, and oldest patient I have our group has our team has operated is 84 years old.
Right.
So we try to pass over whatever skills our teachers have given to benefit of
Absolutely.
patients like that.
Absolutely. Absolutely. So, what kind of heart surgeries usually an adult person goes through?
If you divide the adult cardiac problems, there are three or four main categories. So one is coronary artery disease, which is the most prevalent form of heart problems which our Indian population has. And India is called the diabetic capital of world. There was an ICMR study which shows that
Yes.
almost 60% of Indian population is pre-diabetic and around
Yes.
20% is already diabetic.
Yes.
And they are hypertensive. Our food habits and our natural genetic material is like that, but we get coronary artery disease at a much younger age compared to the
That
Western
is true.
population.
Actually, at a much
So,
younger age. Yeah.
second group of patient is that those people who have rheumatic heart diseases. So this is coming down now, but still we have a big number of patients who have rheumatic fever in the childhood, and now they have developed valve problems, and they come with different lesions of valve. So valve repairs and replacements is the second group of patients in adult category. Then there are some structural disorders like aortic aneurysms. Some people have cardiac emergency like aortic dissections or post-immediate receptor ruptures. So those are the patients we do. We also do some minimal invasive surgery. That is what we call keyhole surgeries. Nowadays, nobody wants a scar on the body.
True.
So everyone wants that. No, doctor, आप चीरा कितना बड़ा होगा, टाके कितने बड़े होंगे? That is the common question. How big my scar will be? So what we are doing in minimal invasive surgeries, we do something called transaxillary surgeries also. Where the incision is not below the breast. So if it's a young child and requires a interceptor defect closure or a mitral valve repair or replacement, if we put a incision below the nipple, when the child grows, the breast will become disfigured. So that's why we have moved the incision from below the nipple to the side into the axillary. So transaxillary surgery is one of the new things which we are doing. Then there are some problems like cardiac tumors and other things. These are the problems which come in adults. These are the most common things which we see in India.
I have heard that nowadays a lot of people go through angioplasty instead of a bypass surgery. So how do you decide who would need an angioplasty and who would need a bypass? I mean, are there any criterias like that?
Yeah. So this is one very, very common and very tricky question actually, because most of the patients are seen first by the cardiologist who does an angiogram and then finds out that there are diseases, the vessels which have disease. So there are two options: we can put a stent or we can do a bypass. So naturally, no one wants to get cut on the body. Everyone is scared of the surgery. So and angioplasty is a quick fix. Like you are in the hospital and out of the hospital in 2 days. So very natural that people would tend to ask for angioplasty. But there are criteria. The European Association of Cardiothoracic Surgeon and Cardiology and American Heart Association, they have done widespread study. And coronary artery bypass grafting, CABG, is the most widely and most extensively studied surgery. And it has been found to be a gold standard for revascularization. So there are people who benefit from plasty. There are people who benefit from coronary bypass. So there are criteria like if I want to tell a layman person that whether you should go for a stenting or not when the cardiologist asks you. So if you require more than one stent, you have to think first. If it's a lesion in the proximal LED, left anterdescending artery, which is the most common artery of heart, it should not be stented, it should be bypassed. If there's a 1, 2, 3 rule I tell. So one stent in one artery is fine. One stent in two arteries means stent each artery is okay. But the moment you think that two stents will be required in one artery, you should always take a second opinion. When you think you require 3 stents in one artery each, that means it's a triple vessel disease. You should always take a second opinion. Maybe surgery is a better option. Then people who are diabetic, because our population they are very commonly diabetic. So any patient who is diabetic and has triple vessel disease, coronary artery bypass grafting is always a better option. It's not something we can divide into black and white. It's right and wrong. But then long-standing studies have shown that coronary artery bypass grafting is gold standard for people who have multiple vessel disease, who have high calcium scores, who have complex coronary artery diseases, who require more than one stent into in a common artery in their stem. So it is always better to take a second opinion when the decision is not a straightforward one, so that you reach the best decision.
So these, whatever you have said, are very highly, medical or technical terms. So when a patient comes to you, how do you counsel the patient? Like, you need this, or you need this, or this is better for you, or that is better for you. How do you counsel? And is it difficult to counsel a patient? Like, what kind of questions the patients ask, or do they at all ask any questions at or because in India I have seen that patients are very this kid, oh, doctor ne bola hai, or this doctor has said, I have to just follow it. Do they ask you questions, or do you counsel them in a certain way?
Yes, yes. Nowadays, I agree. There are many patients who just listen to you. You just said this is required, and they don't question. But now we have another group of people who read, because a lot of information is available on the internet. Lot of misinformation is also available on the internet.
That is right. That is right. The misinformation also.
So then people read about those things and come. Just few days back, one person came and asked, "Is a really frail person, Doctor Sahab, robot se operation ho jayega kya?" They have read something about robotic surgery and they come and ask. So if everyone knows about angioplasty, but it's what is ideally to be followed, and what we practice in our day-to-day practice is a heart team approach. So it is not decision of one person; it's a decision of team. So that a good decision for and it's a patient-centric effort. So there is a cardiologist, there is a cardiac surgeon, there's patient, there's patient's relative, and there is a cardiac intensivist. Sometimes also a post-operative care person, the physiotherapist. All of these see it's not just artery which needs the surgery.
Absolutely.
It's the whole human being which needs the surgery. So if there are multiple comorbidities or multiple other problems, we need to find a holistic approach for that patient. So we follow a heart team approach where everyone comes and discusses, and then we discuss the option with the patient. So these are the pros and cons of plasty. These are the pros and cons of the surgery. These are the pros and cons of taking medications, and these are the pros and cons of not doing anything. Because in our Indian population, we have hundreds of patients who don't do anything. They know for almost 8 years or 10 years that they have some disease. They have been advised surgery, but due to some misinformation or some misunderstanding or some problems, they don't do treatment. So whenever such patient comes, we have to educate them first and then offer the treatment. Sometimes some patients are adamant and they want this thing only. Then we have to counsel them and then find the best way to go forward.
Yeah. So in India, actually, I have realized one thing. As you said, we have to have an holistic approach. That is one very important thing, because they do have comorbidities, and you just stenting an artery or just doing a bypass is not really going to take care. If the diabetes is not taken care of, or if the blood pressure is not managed, then stenting is not really going to give the kind of response which you are looking for. So that is one thing. But in India, I think, as you said, we have to go through European standards or, certain gold standards which the world follows. But do you need to adjust those standards based on Indian scenario? And because for India, what I believe is we also have to take a lot of the financial capability of the person into we have to consider that. Because as you were saying, many people don't do anything because maybe they are not able to do it. They are not able to afford that kind of a treatment. So if patients like that comes to you, how do you all handle it as a team?
Yes, that is one common problem in India. The guidelines which have been given by European or American societies, do they actually fit into Indian population?
Yes.
But we have robust data in our medical field also. Like Indian data is also there, and most of the things bearing few differences. Like our arteries are far more diseased than theirs. Our patients, they generally come in a very advanced stage to us. People, particularly our women, they come very late. They have been having the problem and they keep on hiding it, or they keep on thinking that nothing is wrong. Some people have that He-Man syndrome, that mujhe nahi ho sakta. Some people have that I have a problem, but I can go ahead with some alternative medicines or something. And there are some people who actually cannot afford. The people who actually cannot afford, there are certain ways to get some funds. Our hospital, we are blessed because Dr. Dev Prasad Shetty sir runs this hospital. He is a cardiac surgeon. He is known for making the cardiac surgery treatment cheaper for people. So, one, we offer surgeries at very reasonable cost to all the people who can pay, and those who cannot pay, we have certain ways of getting funds for them. So we are able to do the surgeries at a discounted price. In fact, people who are up to 20 years of old age, if they require an open heart surgery, we have our own mechanism through the hospital and collaboration with some NGOs that we are able to arrange funds for them. In fact, most of the congenital surgeries which I have done in this hospital, they have been done with help of the NGOs and Dr. Vikas Keshri's funds. For older people also, sometimes, most of the times, we are able to help them that way. Some government schemes are there, some good standing government hospitals are there. So somehow we try to find out a way to help them.
So, when I was just talking to you, you said you are from Jharkhand, right? So,
Yes.
and Jharkhand, unfortunately, even today in India, is supposed to be one of the backward states. So,
Right.
how was your journey from a school student to a medical student, and then now becoming a cardiothoracic surgeon? What I mean, do you have any people in your family who are also doctors who helped you, or were you the first person or the first generation doctor in your family? I mean, what was your journey like? What motivated you to become a doctor?
Yeah, I am a first generation doctor. My family is largely a family of businessmen. But everyone, even in those businesses, have been businesses related to engineering field. My grandfather was called Mungalal engineer and Bihari Lal engineer. Both of them used to be few people of the place. It's a very backward place, even now. So there used to be few people in the area who were able to speak English, read and write English without any formal education. They were able to repair all kinds of electronic devices and automobiles in those days. My father was a student of engineering. He was in the Birla Institute of Technology, BIT Sindri. It used to be a prestigious institution those days.
It still
And
is. It still is a very prestigious institute.
it is a prestigious institute, and after 1 year of education in engineering field, he had to leave the education because my grandfather passed away, and unfortunately, we were not so strong financially those days. So when I passed my 10th class examination, that was a question my father also asked. Everyone in our family is either into the engineering, electronic, automobiles, all those streams, or they have studied. My elder brother was doing engineering that time, and some of my cousins, they were also doing engineering. So everyone has gone to engineering. Do you really think you want to go for this? There are two people who actually motivated him. One is Ashok Chacha. We call him Ashok Chacha. By later, I realized he's an RMP. But everyone in our family till date, he goes to him for any medical problems. So
So
I
he
used
was
to
a
see people respect him.
family
Yes,
medical doctor kind of thing.
he's a very experienced doctor, and he is a very genuine and very experienced physician. So till now also, everyone our family in our place, if they have a problem, they go to him, and he will be able to cure and take care of them. So I used to see that he is very much respected. And during those days only, Dr. Venugopal sir, P. Venugopal sir, he did the first heart transplant in India. So it used to come on Doordarshan, and everyone in my vicinity in 95, everyone in my vicinity, he would praise him like a god. So that is what really motivated me to see this doctor. And they used to say, in Dr. Saab, if this Dr. Saab leaves the government hospital and goes to private, he can earn crores of rupees, but he is still in the AIIMS and doing service for the society. So I found that everyone is respecting him like a god. So that was probably, these were the probably two people who motivated me to go to medical field. When I did my MBBS after that.
So basically, that kind of respect you wanted to have from people, that was the basic motivation, that that I also want to serve people and I also want to get that kind of respect.
Probably initiating thing, it's the age of 13, 14 years when you
Very,
decide that
very impressionable age.
respect is not, I mean, that service to the society is not something which is in your mind at that tender age. But at
Absolutely.
that tender age, if you see that person is respected so much in the society, oh God, I should be like that. So
True.
that was probably the initiating factor for me.
Do you think doctors are getting that same kind of respect nowadays?
Unfortunately, not. the things have become much commercialized and much westernized, I should say. I should not say commercialized, much westernized, I should say. And that connect between the patient and the doctor is partially missing, but it is still there. Still there. I mean, there are people who call me on every. There are people whom I have operated long ago who call me on every birthday and every social occasion. And wherever we go, we do get the respect. But things are changing because of the modernization and westernization. But that is the part of the game.
Yeah, true. I know, but I also believe that maintaining that respect is a doctor's job too. Like how you communicate with the patient, how do you interact with the patient. I think that makes a lot of difference, because I at least believe so, because I get that same kind of feedback from my patients. That they love
Yes,
to come back
yes,
to
Shweta.
me, or they always tell me, no, another doctor has not told me this. You explain it to us, you communicate with us at our level, so that we can understand, and we can use medical jargon very easily. But that is not the way to talk with common person. So
That is very true. Communication is the key. Half of our problems could be solved. Although they say एक चुप्पी हजार problems को solve करती है, but that is probably not in cases where emotions and science and biology, everything is coming together. So if we have good communication with patients, half of our problems will be solved.
I can see when I'm talking to you that there are, so many certificates behind you. You have written so many certificates. I can see. I don't know what they are, but I can see that you have achieved a lot of accolades in your life. So, what has been your most recent achievement? I would say. I heard that you have just got your FRCS.
Last year I got my FRCS fellowship from Royal College of Surgeons. It's an exam held internationally. So we had some group of friends who were motivated to keep studying. So after my MBBS, I did my post graduation from Mumbai. Then I did my MCH training from All India Institute of Medical Sciences. Uh, there was some maybe peer pressure that we need to go to training to UK for some time. So that is how I initiated on this path. So I wrote the exam of European Board of Cardiothoracic Surgery, and by God's grace and my teacher's blessing, I passed that. Then I did the fellowship of Royal College of Surgeons of England and Edinburgh. So that was part of the keeping yourself updated with the education and recent developments also. So that is how it happened. It's
Yes.
all God.
Yes, absolutely. And I sometimes, that's what I've realized, that a doctor's learning never ends. Like, you just keep studying, you keep studying, you keep studying. And you have to gain, every time a new innovation comes, you have to, get abreast of that, because obviously, patient care depends on that. So if you really want to be relevant, then you have to keep keeping abreast of all the newer technologies. So,
Absolutely.
yeah, yeah. So you are, I mean, I just wanted to know how has this, these European board certification and MRCP, FRCS kind of, certifications and fellowships, do they actually help you in your career? I mean, as a patient, do the more patients look up to you that, okay, this person is like, internationally certified, so this must be a better doctor? Does that work that way?
Partly you are true, partly not, because as I believe, our Indian training is very robust, particularly the surgical part of training is very robust. There are reasons because we still follow that Guru Shishya parampara. That culture is still there. So our teachers they take the real effort in training and teaching you, and even the discipline they always respect their teachers. Second thing, we have a vast population of patients, so our experience is far better than theirs. Only thing probably where they get an upper edge because they maintain their records very well, they follow up. They are rich countries, so they can afford to do those things. Their research is not far, but little more advanced than us, and their way of examining the patients is little different compared to us. What I felt by writing all these examinations. But overall, I feel it is the same thing. It is the same biology and same physiology everywhere. So it is little bit in difference in teaching and training and evaluation process, which is there. And what you just said, communication. their communication is far, far, far more than us, because just now you said we have to keep ourselves updated with the recent advances. Nowadays, the patients themselves are also very, very updated with the recent advances, because there is something called internet, which
Yes.
gives you all the information, even the research which is not published, that is available on the internet sometimes. So in communication, they are definitely little different from us. I will not use the word better. Their method of examining and assessing the candidate and communication is little different from us. It is not, I will not say better.
Yes, and I think what you rightly said was like, their maintaining of records is definitely better than us.
Definitely better.
Yes, so that way, when we say that, record based or evidence based treatment, then sometimes those records definitely help us, in deciding that what would be the best form of treatment for this particular patient. Yes, so that way maybe they have a little bit of an advantage over us, but as you rightly said, I know with the kind of vast population which we have, our experience, level of experience, and we always deal with, very advanced cases, as you were saying, so I think we can handle patients in a much better way. I mean, we are no less than the Western world. That's what I would like to say. So yeah. So, but what kind of day do you normally have? Like, you start with a surgery normally on an everyday basis, or some days you have a surgery and some days you do only OPDs, or like what kind of days do you normally have?
It is generally we keep our operations in the morning hours, because generally our operation lasts 5 to 6 hours. Sometimes they last longer also. So generally our day starts when we reach hospital. Our day starts with seeing the old operated patients, a quick round of the ward and ICU, and then we go to the operation theater. Once we finish the operation, if we know we have only one operation, then that day we keep our OPD in the evening hours. We know prior that most of our patients are by appointment. Know prior that this operation is going to last longer, so that day we do not keep the OPD. Some days we operate one patient, some days we operate the second patient. When we operate the second patient, we finish by 6:30 or 7. When we operate only one patient, we finish maximum by 2 o'clock. And then remaining day goes for the outpatient. Once we finish the operation theater, we again go to the ward, see the patients, what is being posted for next day, all those things. And sometimes we don't have patients, that day we use for keeping up ourselves abreast with other developments.
So you're dealing with day in and day out, you're dealing with complex procedures, which are literally life threatening. Like, people say this is a life threatening situation, but you are actually dealing with literally every day a life threatening situation. How do you manage to maintain your calm, and then, think properly so that you give the best kind of treatment to the patient, or you do the proper surgery for a patient to get the best outcome? How do you maintain that?
So that is again where our Indian system comes to our help, because we have been used to do this since our passing our MBBS. That we most of us we have got our training from government institutions. We are always understaffed and overcrowded.
Yes.
So that is how we have been able to take care of big crowds since early training period. So that Indian training comes to help. We do little bit of meditation, little bit of yoga, which I advise to all of my patients. Unfortunately, they don't. Most of them don't follow.
Right.
So we do a little bit of that, and then our family. I have a very loving wife and a beautiful and small daughter. So when we go back home, they are the stress busters. When patients get back to you with cure, that is also a stress buster for doctors.
Absolutely, that's a
I am
definite
sure you will
high.
agree.
That's a very good, very extremely high level of, that's the best kind of high you can get. That the patient gets better. So that definitely, as you said, is a stress buster. So as you were saying that nowadays patients are abreast of all the latest technologies, and they come to you thanks to Google and thanks to internet. They come to you and ask, that, as you said, some patient came and asked you robotic surgery. Will you do a robotic surgery for me? So what is like, you were talking about little bit of minimal invasive surgeries. So can you give us a little more detail about those kind of surgeries, and you must be regularly doing them now, right?
Yes. So I firmly believe, and I am sure you will agree, educated and informed patient is better than an uneducated, uninformed patient. if the patient has gone and read about all the recent advances and developments, I'm sure he has read about the complications also and problems associated also. So it becomes little easy to educate that patient and
I'm
counsel that
sorry to
patient.
say, I'm sorry to say, but they read of the advantages, but they refuse to accept the complications or
Accept.
this, and
Yes,
then it is so difficult to explain to them that this is these can be expected,
can
that they don't want
yes.
to understand and accept. So that is where the
So
problem comes up.
that is very natural. People want to listen. People listen what they want to listen.
Yes,
But still, if the patient has done his research, you can show that same research to him and show that these are the problems, and you can always counsel the patient. Particularly as a cardiac surgeon, we deal with not only cardiac problems, the renal problems, hepatic problems, the pulmonary problems. So we keep all these friends, colleagues also in our circle, and we deal and discuss with those patients. And it is always good to have pre-operative or pre-planning and communication with the patient. That is where our team approach comes to help. And what I would say that a good pre-operative explanation and planning is the most important thing in our field.
as you said, if you talk about it before the operation, that okay, even if there is a 0.1 or 0.01%, that 0.01% still exists. So that it becomes very important, because I'm specifically asking you this because with from the basis of the kind of violence which we see against doctors nowadays, like and I feel that that mainly happens because the patient was not communicated in advance, or in before a certain procedure or something. I don't know, because we keep reading about these things, that violence against doctors, isko mara, usko pita, why did the patient die, or why did this go wrong. It becomes difficult later. So I mean, how do you all kind of, as a group, handle these kind of situations?
These things have become, unfortunately, they are becoming common very fast. And this is again because of westernization and modernization and commercialization of the medical system. I agree. But I would say the fault is on both parts. Some people come to us with unrealistic expectations. Most of these things happen in patients who are very sick. And more often than not, those patients have been brought to the hospital in a very advanced stage. This is the common problem we as a doctors face. Many people, they have been advised of surgery and they keep on taking medication. दवाई के ऑपरेशन के बिना आपका 4 साल निकाल दिया. They don't realize that they have not spent 4 years. They have wasted 4 years
Exactly.
because they did not get this timely surgery. So that is a big problem we face, because we get patients in a very advanced stage.
True.
And then some people, I'm not again blaming my patients. The patients are always prime, but some people have unrealistic expectations.
Yes,
They
that
come in
is.
with advanced stage and they win miraculous treatment results. Some of the fault is definitely, I will not say it is not on doctors. There is lack of communication and lack of explanation. That is why I said in all fields, planning and proper communication is always a prime thing. It is a touchy subject. If I say doctors are not responsible, my friends will not feel good. And if I say patients are not responsible, the other people are not feel good. But definitely, I will say it is a 50-50 fault on the part of doctors also and patients also.
True, true. And as you said, the biggest problem is having unrealistic, expectations.
Yes.
It is, I mean, and that these kind of unrealistic expectations come from, reading from internet, and, as you said, people just want to hear or know only what they want to, only that much part. Whatever is positive, they want to know or hear, and whatever is negative, they just want to overlook the whole thing. Overlook the whole thing. So that sometimes definitely creates a problem. But I think as a team, you all do take care of it as a proper counseling pre surgery, like that becomes an essential thing. So I was also reading in your website, and as a Narayana group, at least, see, I'm from Bangalore, and in Narayana group is a very well known group in Bangalore. Dr. Devi Shetty is like God here, like especially for cardiac people. He definitely see, like like it's been looked upon as God in that field, which is, to a certain extent, it is very true also, because he's really helping a lot of people here in Bangalore. At least we get to know. So here, I was reading that in your this website, as I said, that you all do some you all do cardiac transplants also, heart transplant. Does your this institute do it, or like are you planning to do it? What is the scene like there?
Right now in the Narayana Hospital, Gurgaon, this branch, we are not doing heart transplantation. We have a full-fledged liver transplant team and a full-fledged kidney transplant program. We have donated hearts for, heart can be harvested for transplantation from our place. So we have, from our hospital, heart donations have gone to other hospitals. But as a group, Narayana group is performing a large number of heart transplants, both in our Bombay and main Bangalore
Bangalore
centers,
Center.
and we have a heart failure program. So we can, if there is patient who comes to Gurgaon or who requires a workup for heart transplantation, we have a video consultation available with our heart failure team in the Bangalore or in-house cardiologist, and then we can always help them to reach to Bangalore.
Heart failure for a lay person is like, has my heart failed? Like, so when you say heart, who needs, what do you mean by this heart failure? Who needs these heart transplants?
Heart transplants are for the people who have end-stage cardiac disease. It can be of various etiologies. Most common form is what we call idiopathic dilated cardiomyopathy. These people, basically, they have the heart muscle itself a disease. It is not able to pump the heart. So in normal layman's function, they said the heart function has become less. The normal ejection fraction, what we call technically 60%. Other people, they have the, so there are multiple causes. Most common is idiopathic cardiomyopathy. Some viral myopathies are there. Some end-stage coronary artery disease patients also require heart transplantation. Some patients who have end-stage valvular heart disease, they also may need a heart transplant. It is a matter of investigation which is done before we decide whether this person is fit for heart transplantation or not. Most commonly, heart failure with reduced ejection fraction, and most common cause is idiopathic cardiomyopathy.
What is the kind of awareness in donation, organ donation? When you talk about heart transplant, you obviously need an organ. Somebody has to donate.
It is phenomenally poor. It is phenomenally poor. Even if when we ask patients to donate blood, just blood donation itself is a big problem. When
Yes.
it comes for open heart surgery, mostly our patients come from UP and Bihar and Haryana, the so-called Hindi belt. When patient comes for open heart surgery and we say blood donation is required, you need to donate 2 units of 3 units of blood or 1 unit of blood. As such, we do most of the surgeries without any transfusion. I think our average is definitely less than national average. We do most of the surgeries with our auto transfusion. But still, when you ask the patient's relative to donate the blood, the first question is, Dr. Saab, kahin se mil nahi jayega? Can't we get it from your blood?
Yes.
But what I said, blood is meant for circulation. If I donate, you get, you donate, someone else will get, and someone else donates, I will get. So if it comes to blood donation, then itself there is so less awareness. Organ donation is one step further, and particularly it's the heart transplant is a cadaver donation. Already emotions are running very high.
Very high.
It is generally the donor is generally a young person, because old people's heart will not be suitable for being transplanted. So already emotions are running very high. They have lost so that is where our transplant coordinator, their help comes very handy. We need to talk to the patient's relatives very calmly and in a very sympathetic way. But slowly the awareness is becoming larger. Because most of the kidney transplant and liver transplant, they can be done by life-related donors.
Yes.
But particularly for heart transplant, it is already one calamity has occurred. But there is also a way of thinking for many people that there is some ray of hope in this disaster also. That my son or my daughter or my father or my mother can be, my brother can be helpful to some other people. So slowly that awareness is becoming bigger, and especially I'm again sorry to say in northern part of India, this awareness is very less compared to southern India. We need to play on the emotions, like, your person's heart will live in somebody else's, like, Yes.
so wo zinda rahega types, so that kind of emotions sometimes does work. But that is the only way, because otherwise, yeah, that's what I was thinking. The donation, organ donation, awareness is extremely poor in our country. So, do you get heart easily if you have somebody needs, or there is a long waiting queue?
No. Generally, it is a very systematic way of being on waiting list. So people who require a heart transplant, they have worked. There is battery of investigation which is done. Mostly it is done by the cardio. It's again team approach, cardiologist and cardiac surgeon, they do it together, and then the person is kept on the waiting list. And then there are ways of grading this priority also, who gets the heart flush first, and it again depends on the fit, if it's a child or whether it's an adult. So there's a waiting, there's NOTO and ORBO, these two organizations are there which manage, and then every state has its own organization which takes care of this waiting list. As per the waiting list, people are called because when heart is available. I remember one guy, he was an engineer, he got a transplant in AIIMS, and he got a transplant from a girl who was also an engineer. So I just asked me, how did you land up? So he said, sir, I got a call from hospital 3 times that can you come in next 4 5 hours to hospital? We might have a heart available, because it is not a planned event.
Yes.
It becomes available all of a sudden.
Yes.
So 3 times I missed, because whenever they call, I told I'm in Dehradun. It will take me 4 5 hours, 7 8 hours or 12 hours. Then he took accommodation in Delhi. He stayed in Delhi for 6 months, and then he got a call and he just came to All India Medical Science and got a transplant. So that is how you are on a waiting. The person is on a waiting list and he gets according to the priority.
So, what kind of lifespan a person can look at, after a transplant?
I think in All India Institute of Medical Sciences, what we have the data. The people have There are people who have lived for 12, 17 years and 18 years also. In fact, I don't know I'm allowed to take the names or not, but one of the heart transplant patient is also a transplant coordinator in All India Institute of Medical Sciences.
Wow.
So life expectancy depends on a lot of other things, whether match was good or not, whether post-operative management was good or not, whether the immunosuppression and other things are good or not. But by and large, most important thing is people who go for heart transplant are really sick. They are NYHA, what we call NYHA class 4, means they are not able to do day-to-day activity. But after heart transplant, they become NYHA class 1. Most of the people, they live the
Normal life. Yeah, normal life. So, you said that you also work on kids, like, smaller kids, their heart surgeries. So, what kind of surgeries normally kids go through, and are there any newer, more innovations with you, if you would like to talk about?
The congenital heart diseases are again two groups, cyanotic and acyanotic groups. Those are technical details. But what
I mean, how
message I want to give,
layperson?
what message I want to give through you, that whenever a child is diagnosed with a hole in the heart, this is one very big problem I face working in backward and remote areas. That a child is diagnosed with a hole in the heart.
Is it
Many
very
times
common?
physician-
Is it very common, the hole in the heart?
It is very common. It is
Oh,
very common.
okay.
And when the child is diagnosed, one thing the physician says कि जब बच्चा बड़ा होगा तो छेद भर सकता है. When child grows, the hole might heal. What the parents, nobody wants to listen to bad news. What parents listen is that when child will grow, hole will heal.
Yes,
There's a lot of difference between might heal and will heal.
absolutely.
So that is why when this is the message I want to give to many people. I have seen girls 16 years old, 19 years old, boys 12 years old. They have become inoperable because as the age grows, particularly in acyanotic groups, the lung pressure in the lungs, in layman's language, the pulmonary artery hypertension, the pressure in the lungs start increasing. And once it goes beyond a certain limit, that child who could have been operated with just 1% risk in half an hour operative time or 2 hours operating time becomes inoperable. So it is a crime to lose a life because we have not given the right treatment, because it is available in our society. So many times parents do this, that child will heal and they don't see the doctor for very long duration, 3 years, 4 years, 10 years. I have seen a patient who was not seen by a doctor for 16 years because someone at the age of 1 year said that hole will heal, and the child has lost the time and he will not be able to operate. Sometimes these problems become complex. Suppose there's a small hole and there's a valve nearby. That hole heals by pulling the valve leaflet. So patient who has a ventricular septal defect has lost aortic regurgitation. So a small problem has got converted into bigger and more complex problem. So that is why my message is, whenever someone says that there's a hole in heart, you must, sometimes the diagnosis is missed by a little less experienced doctor. So whenever there's a diagnosis, a hole in heart, you must see a specialist. First, confirm the diagnosis is right or not.
Right.
Then secondly, confirm whether I can wait or not.
True.
Only when a specialist, pediatric cardiologist and pediatric specialist has showed that you can wait for some time. You wait, and even if someone has said that hole might heal, you just get it checked whether it has healed or not, or whether it has healed properly or not. That is the biggest problem.
True.
We go to bank, no, I withdraw some money. We always check that the 10 notes are there or not. So why not with our child? Someone said that child will become right. Why not I go and check it? The child has become right or not. So this is one message I want to give to parents.
Very
They
good.
must consider this.
Very good message, because we take things so casually otherwise, and we only, as you said, we only want to hear whatever, like, is the
We
positive
want.
part. That, yeah, that's what we should, the viewers should listen to this, listen to what the cardiac surgeon is saying, that, if you have a child, or if you know somebody who's having a child with a hole in the heart, I mean, the child has been diagnosed, then please, please, please go to a cardiac surgeon, or please go to your cardiologist, or please go to a specialist who will be able to guide you properly. And don't wait for 10 years that, okay, the child will heal. At least every year, keep assessing whether the child is healing, whether the hole is closing down. Am I right, doctor? This is what they should
Very
at
true,
least,
very true.
they should at least do that, right? So I was just reading that, you are also quite passionate about academics and training. So what kind of training do you all impart to your junior doctors?
See, our medical field inherently it is you will agree it inherently it is a part where you do teaching and training. It's incompensated. Like we always learn something from our seniors and always pass it on to our juniors. So one of my aims was to be a teacher. I'm not a traditional a teacher in a traditional way. I wanted to become a professor and assistant professor and professor in some government college or a teaching hospital.
Okay.
Unfortunately, I am not in a teaching hospital now. But as long as I had an opportunity, I tried to teach a few things to my juniors. I hope I have been able to do it. But even then, when we are now working in private setups, but even here we get nurses, we get junior doctors, we get some intensivists who come to us and who are little less experienced in years, not in knowledge.
Yes.
They little experience in years to us. So we just try to pass over whatever little we have learned with the blessing of our teachers and our gods. And I think that is how it should be. Unless we pass our knowledge to the next generation, the knowledge will cease to exist. That is why we have been suffering in our cultural development, because India was supposed to be Vishwaguru in older
Yes.
days, but we have not been able to pass this information. So I firmly believe that whatever little we have learned from our teachers, we must always pass to our in whatever
Absolutely.
little capacity we have.
What is the most important quality a junior doctor should develop to become a great surgeon?
Yes. So it is a difficult question because there are a lot of things which make a successful and a good surgeon. First thing is knowledge. You cannot compromise on it. You have to be abreast with the latest knowledge. You should know your patient's problems and whatever the options are there. Second thing is capability, which you will learn from your teachers. That is also probably workable. The most important thing is probably discipline and integrity. These are the two most important things for becoming a good and successful surgeon. Unless you are very, very disciplined, unless you have that perfectionist attitude, anyone cannot become a good surgeon. It has to be a surgeon has to be absolutely disciplined. And third, fourth most thing is integrity. If we are not integrity, if we are not true to ourselves, we don't have to to be true to your patients. If you are true to yourself, you will definitely be true to your patients. So if you are not doing something which is not allowed by your consciousness, you will always do something good for the patient. So when we have a patient-centric approach, we'll definitely become a good surgeon, a good doctor, and a good human being. So any good human being can become a good surgeon if he has discipline and thinks about the patient first.
Right.
Those are the most important qualities.
So I just would like to ask you, like, can you share, without giving, of course, any patient details, that, something, a very interesting case which you have operated recently, like, something very abnormal, or, unexpected, or something very interesting which you remember, like, you have operated on recently?
There have been patients, not very recently, few I think maybe 2 years ago. There was one patient. Uh, I think part of the identity will be disclosed. That is okay. This patient, he had some problem and he went to some other hospital and they thought this patient has something called a stroke, like normal people paralysis. So
Hmm.
nowadays, treatment for early presenting stroke is thrombolysis.
Right.
So thrombolysis means lot of for layman's lot of blood thinning agents are given, and that clot which is formed in the brain blood vessels of brain that gets lysed and the patient's paralysis gets treated. So this young man was thrombolized, and then uh, after the thrombolysis, those doctors realized no, there's something else is wrong, and then they did some tests and they found he has something called aortic dissection. So aortic dissection again for layman's language, it is a crack in the largest blood vessel which is coming from the heart. That is aortic dissection, and it's a life-threatening situation. I mean, almost 50% of people are dead by 24 hours. It needs to be operated then and there, and it's a huge undertaking. It's a big surgery. Uh, a, a, Actually, itself aortic dissection is a killing disease, and the surgery is very risky. So then this person was sent to us in one of the hospitals where we were working, and it comes at around 6:30 or 7 o'clock in the evening. Most of the bad news comes in the late evening hours only.
Yes,
So
absolutely.
he comes at 6:30 in the evening, and now we know we have to do a supra major surgery for this patient, and that patient has already withdrawn supranormal doses of blood thinning agent. So already this surgery leads a lot of bleeding, and this patient is already on blood thinning agent. So we started the surgery around 7 o'clock maybe or 7:30. Uh, Probably surgery was over by 12 o'clock. But from 12 o'clock to till next day morning around 4 o'clock or 5 o'clock, we were struggling to control the bleeding. Kept on bleeding. So there's something called packing. Layman people will not know, but then whenever we do an open heart surgery, the sternum is closed. It is closed with the wire. But sometimes we have to leave it open when the heart is not very good, or it has some problem or bleeding. So we just packed the wound with the gauze pieces and brought him to the ICU, hoping that this bleeding will stop in some time. We attached a sucker which sucked the blood from the pericardial cavity, and we kept on transfusing it back again, and it was going on and on. And then remember I spoke to relatives at 4 o'clock in the morning. We said the surgery had gone well, but we are not able to control the bleeding, and this is the problem. Then there is a medication factor 7 which has to be given, which is a very costly medicine. So we asked whether we have your permission to give this medicine. No, doctor, you just don't think about it. You just give it off. We gave that factor 7 also, but bleeding would not stop. We shifted him to the ICU, and then we observed for next 3 to 4 hours. His chest was open. Then he had a cardiac arrest.
Oh,
He had a cardiac arrest, so we did an open cardiac massage. So while we were doing the open cardiac massage, one of the class 4 brahmacharis, like Aya or whatever you call that GDS, we call them GDS. So one of the GDS, woman GDA was there. So one of the sisters inadvertently told her to give something. Sister, Didi jara ye la ke dena. When she came there and she saw that I am sitting on a person's open heart, open chest, and pushing the
pumping the
heart
heart.
with my own hand, she fainted. She fainted, and she had an injury to
Head
the head.
injury.
She had some cut. So one sister got engaged in treating her, and somehow that patient, we were able to revive. After doing the open cardiac massage, we were able to revive. And then we spoke to relatives that situation is very bad. And as you know, it was going now it's almost 12 hours since patient was taken in the operation theater. More than 12 hours. They were getting agitated. Why it is not stopping? Why you people are not able to stop bleeding? Bleeding to रुक जाती है, सारे operation हो जाते हैं. Why you are not able to close the chest? But somehow I don't know what happened. I really don't know. Some few hours, 1 hour later, that bleeding related almost miraculously
Stop.
stopped like anything.
Wow. Wow.
Why he was bleeding around 100 ml every hour, now it has stopped almost not even 10 ml per hour. So we became some hopeful. I spent that night and day in the hospital. By evening, his kidneys stopped working.
Oh,
Now, in such sick patients, you cannot do the regular dialysis. You have to give a CRRT, what we call continuous renal replacement therapy. It is again a costly thing to start in a private hospital. Again, we went to the hospital, to the relatives, and said, "Ki, bhai, we have to start this, and you have to pay this amount of money for this
right.
also. Is it okay? Will you?" डॉक्टर साहब कितना पैसा और आपको चाहिए आप ले लीजिए
that is
that
what.
was they were getting agitated, but again they said, "You take this money, you go and start." We started, CRRT. Then somehow we were able to spend that next night. Almost 36 hours later, after the surgery, we took him to the operation theater. We removed all the packages, and we saw that there is no bleeding now. Thank God. Then we closed his chest and brought him back to the ICU. but he was again on the ventilator for next 2 days. Next one day, I think 12 hours, and then while he was on ventilator, I was sitting like this in the OPD, and some 15 relatives they came, and now they are all because private hospital bills are also running.
Right,
I
of
have
course.
already said this surgery is going to be costly. Then once I asked for that costly medicine, and second time I asked for that costly renal replacement therapy.
Right.
So now that same picture is coming. This doctor trying to make money out of my misery?
That is
So some
what.
15 relatives, and then they were getting agitated, and
Of
I was
course.
on the verge of being beaten. I thought I will also become a news in newspaper today, maybe, because I was not able to explain. It is not their fault. They are all very stressed because it was young, 32 years old male. He
True.
was younger than me. So it kept on going on like that. Then I said, but आप डॉक्टर साहब ये बताइए कि वो बचेगा भी कि नहीं, वो जिंदा भी है कि नहीं. So it's instinctively it came out of my mouth. हमारे बिहार में बोलते हैं कि जाको राखे साइया मार सके न कोई. So
Right.
the gods are saving now. So if he has to, because he has lived for 48 hours after all those problems, I am very sure he'll arrive. Then he said, Doctor, you are from Bihar. So I said, yes. So that person's wife, हमारी बिटिया, she's also from Bihar. So where are you from Bihar? So it's my habit because I was born in Bihar and it became Jharkhand after I left the
Right.
place.
Hmm.
So always I introduce myself as a Bihari to everyone. I feel I'm a Bihari. So I said, no, it's not Bihar, it's Jharkhand. So our bitia is also from Jharkhand. So where is Jharkhand? So I said it's near Daltonganj. There's a place called, because my place is a very small place. When I joined MBBS, there was a survey in the Times in India Today, and it showed this is one of the 10 most backward districts of India. So I was sure that this person will not know. A person in Delhi, how would they know about Garhwa, where Garhwa is? So I said there's a place Daltonganj, and I'm from near Daltonganj. So the bitia is also from near Daltonganj. So, oh my God, this is getting tricky. So where in near Daltonganj? So I said I'm from Garhwa. Our bitia is also from Garhwa.
Oh my God.
So I was surprised, what is going on? So where in Garhwa? So I said I am from Main Road. So bitia is also from Main Road. So I said, oh my God. So I finally then asked her, what's your father's name? And then she said this name, my father is. So I said, oh, आप चाचा जी के बेटी हो? I didn't know. She was almost 15 or 17 years younger to me. So obviously I would not know. By the
Obviously,
time
yeah.
she was born, I had left the
Right.
city.
True.
Not city, it's a small village town. So then I realized she is daughter of that person. Then I said, then I became bhaiya all of a sudden. From doctor, I became a bhaiya.
Absolutely.
So probably that day, that saved the day. And by God's grace and my teacher's blessing, that patient also started showing signs of improvement. And few months back, when my daughter was born, 1 year later. So now her daughter is, so 1 year back, she sent me a photograph. Now I have become mother of the second baby. So he got better. Then he went out. Now he is leading a normal life. He became father of a second child.
Wow.
And they are very thankful. So this was one big episode. It kept on going and going.
Absolutely.
Send him home.
It sounded just like a Hindi film kind of a story, you know. Like, you know, first this happened, like, and then full tearjerker kind of a thing, you know, कि ये हुआ, वो हुआ, and then but the final outcome is always a happy ending. So you know that is such a nice thing.
It was an happy ending.
So you are a cardiac surgeon. I just wanted to know how many ladies are there as cardiac surgeon? Women cardiac surgeon.
There is a big number now.
Is it?
It used to be very less.
Mhm.
It used to be very less.
Mhm.
I remember when I joined All India Institute of Medical Sciences, Dr. Vinita joined with us. And she was a lady in the department after a long time, really long time.
Right.
Before that, I think there was only one cardiac surgeon in All India Institute of Medical Sciences before her, I think. Then one fine day it happened, and she gave over when we were shift changes, we gave over this patient, this is theta. One day she gave over to one of our juniors, and that day we celebrated it. That it is a historic day when one lady cardiac surgeon is giving over to another
cardiac surgeon,
So
lady cardiac
among
surgeon.
The residents, yes, among the residents we had a small celebration. That one after a long, it is a rare thing. But nowadays, even in All India Institute of Medical Sciences, there are a lot of lady cardiac surgeons. Even in our association, there are a lot of cardiac surgeons, and there is no reason they will not be. They cannot be. It is as good any science as our women have been doing, and they are breaking all the glass ceilings. This is already broken.
They are breaking the glass ceilings.
Lady
yes.
cardiac surgeon is a rarity now.
It is not a rarity. You're saying now.
Yes. There are
Okay.
lot of young women who are taking this as a challenge, and they are doing phenomenally good.
Good, very good. I mean, it's so good to hear because otherwise, it was such a standard thing that, being a lady, at least in our generation, I can say that, if you are a lady, you can do only gynec, you can do only pediatrics, or you can do those smaller, branches like, ophthalm, ENT. I mean, you don't need to go for so many, emergencies. You need to take care of the house
No,
and all.
no,
So
no,
that
no.
kind of concept is breaking, which I'm very happy to note.
There's no branch is a smaller branch in medical science. Everything deals with human beings and human emotions. I don't think being a cardiac surgeon is a much greater thing than being any other specialty. That is a different thing. But this glass ceiling is already broken. A lot of women cardiac surgeons are coming to other field and they are doing very good. And the number is going to be increasing.
That's a very heartening to hear actually, because see, and what I'm trying to say is because nowadays if you see in medical colleges, majority of the students who are joining are ladies. Like, men are very few, men are actually, boys are joining medical schools. So, the number of
In my
number
class,
of people, men joining medical schools are actually going down and ladies going up. So,
in my class, there were 67 women and 37 of us boys when I joined MBBS in 1998.
okay. No, I think we had around 50-50 kind of, 48-52 kind of, so it was okay. So not too bad, not too great. You were talking about this, coronary artery diseases and bypass surgeries and angioplasties and valvular diseases. And you're also, as I said, you were also talking about academics and teaching. Are these, these kind of health problems, how much of them are preventable? And what do? You say that you go to your village to, educate people or do camps and all. So how do you explain and what do you think, what is the role of prevention in all this?
Definitely, definitely. These are all non-communicable diseases. So prevention goes a long way in preventing non-communicable diseases. And more than that, hypertension, diabetes, blood pressure, uh, coronary artery disease, these are all lifestyle diseases. These are due to our bad lifestyle. So we have to improve our lifestyle. And that is the first advice we give. Unfortunately, it is not heeded. Most of the people don't follow it. But that is the first advice given for all non-communicable or lifestyle diseases, that lifestyle should be modified. So what is that modification? What is the preventive things we should do? There are some things we should do and some things we should not do. So first thing is that you get up in morning from there itself. So your timetable, it should be disciplined. Your sleep wake cycle should be relatively routine one. It should not have work erratic hours. Then comes some exercise. So exercise is the most important, single most important thing to prevent blood pressure, prevent diabetes, and prevent coronary artery disease. The American Heart Association tells that you have to do 20 minutes of brisk walking at least five times a week. That is the most important, single most important intervention you can do to prevent heart diseases. And it is not a big thing. You don't have to buy all that fancy gadgets, or you don't have to go to the gym. You just get up in morning, start at 7 o'clock, 7:15, wherever you are, return back to home. That 30 minutes or 20 minutes of brisk walking is all it takes. And everyone has time for it. Everyone can get time for it. How much ever busy you are, you have to take some time out for your heart or your health. Then comes food habits. We have very dirty food habits. As a population, we are very lazy population. We don't do any exercises, and we eat all sorts of junk food. That has to be avoided. We have to take as much as green leafy vegetables, as much as seasonal vegetables, as much as of millets and roughages in our diet. We have to cut short on all sorts of fatty acids, because these are the things which cause harm in the long run. Then comes to your sleep habit. We have to sleep at least 6 hours a day. It has shown, studies have shown that if the people who sleep less, they have high chances of getting diabetes and obesity. Obesity is another factor which is going to cause a big problem in coming days. As a population, as a society, we are an obese society, and it is going to be the next what you call epidemic in coming years. So these things should be taken care of. There are certain things you should not do. First and foremost is tobacco. Tobacco in all forms is a poison. In 5 years, 500 years or 700 years, or whatever of English medicine or all kinds of medicine, we have made medications from afim also. but we have not found any medicinal use of tobacco. So in all forms, tobacco should be stopped. In all forms, alcohol should be stopped. One very common question people ask me, Doctor Sahab, heart ke liye little bit of alcohol so we can take. That is wrong. That is wrong advice. There is no well conducted study which has proved that you can take small amount of alcohol. And WHO has done an extensive study in European population. They have come up out with the results in 2022, and it shows that alcohol in small social amounts can lead to 7 different types of life-threatening cancer. It is very high in prevalence among the women also now in European population. So the minimum amount of alcohol which is permitted by WHO is 0. It is not 30 ml or 60 ml a week. It is 0. That is what is their recommendation. So much so that Ireland has become the first country. Coming 2025, it will become mandatory for all alcohol products to display a health warning that alcohol is injurious to health and pregnancy. So alcohol should be avoided at all costs. Smoking and alcohol is the 2 most common causes of any forms of diseases. Then things which we should not do, we should avoid all junk food. All these big companies which are throwing their products in the market, they are actually causing long-term harm. Then sugar is the new cocaine. They have done a study. Sugar was given to 1 mice and cocaine was given to 1 mice. They found that mice fed on sugar became addicted to it fast. So sugar is very dangerous. All sorts of addicted cold drinks. They are very dangerous for heart, and they should be stopped and not taken at any cost. Again, if there is one single take-home message I can give through this podcast, that it is exercise, exercise, exercise. More than your food habits, your exercise is more important to prevent all sorts of non-communicable diseases. That is very important, and that should be practiced right from childhood. That is the second message. Yoga and pranayama and meditation, these are not medications. These are not treatment methods. These are lifestyle methods. This Jivan Padhati hai. This is our lifestyle. So these things should be inculcated in our children at a young age. Once you have become already 60 or 70 years of age, these things are not going to reverse the thing. But if you start these things at a young age, they will prevent its development.
Right. So now I think you all can understand that when a cardiac surgeon says this, that, what are the ways that we can prevent these problems? There's the lifestyle problems is, as he said, exercise. And I'm sure everybody can take out at least 30 minutes of time from your life, from your day, every day within 24 hours. Taking out 30 minutes is not difficult at all. Take care of your diet, eat healthy diet, avoid sugars, avoid fats, and definitely avoid smoking and alcohol. As he said, alcohol, WHO says no amount of alcohol is good for health. It is 0 alcohol. So please take care of these things so that you can avoid problems and you don't need a surgery. I'm sorry, doctor, you are doing surgery, but I'm telling people to avoid surgeries, and this is the way they can do it. I'm sure you will agree with me.
Definitely not.
Okay. So the next one I would like to know is, are there enough women in your, doctors who are cardiothoracic surgeons? Are there, and, how are they managing their work-life balance while they are, working in such kind of a demanding job?
Yes. Nowadays we have many number of cardiac surgeons. Young women are taking. When we joined our training as a cardiac surgeon in All India Institute of Medical Sciences, few with us, Dr. Vanita. She is a terrific lady and terrific surgeon. She joined with us, and she was one after a long time in All India Institute of Medical Sciences. And then one day she gave over. When the shift changes, we have to
hand over.
The patient.
Right.
So one day she gave over to another lady cardiac surgeon. That day we residents celebrated. This is a historic day because women resident is given over to another lady resident. So, but now even in All India Institute of Medical Sciences, there are a lot of women who are taking up sciences, and they are doing terrifically well. They are doing tremendous job. So that glass ceiling is already broken. If you think that there are not enough women cardiac surgeons, that glass ceiling is already broken. They have entered the field and they are doing phenomenally well.
So in those 10 years when you did, or 15 years when you started, and now, as you're saying that,
Things
more people
have
things have changed a lot. So, okay. So now in the next 15 years, we can see more cardiac surgeons, ladies cardiac surgeons, well-known cardiac surgeons. That is what you're trying to
Already
say.
there are many, and you will see much more.
The thing is that, what you said is a little bit contradictory to come what we see in the society. And you can take the news as what we read, as you said, you read newspapers every day. The kind of news we read in the newspapers, of ladies, people taking advantage of ladies or devaluing their, dignity. That is one side of the coin. Another side of the coin is that you're saying that women have broken the glass ceiling of becoming cardiothoracic surgeons. I mean, what kind of dichotomy are we having in our country?
That is bound to happen because it's not a problem which has got created in a day or two. It has been as long problem. So, but definitely, slowly we are making progress, and slowly they are coming. Women are coming in all fields of life. To cardiac surgery is not an exception, and I don't think there is any exception. Women are coming up in all fields of life, and they are doing phenomenally well. So, I am sure with time these things will change for better only.
After hearing this recent tragedy, which we heard from RG Kaur, has your hospital and your administration taken any specific measures to take care of lady interns and lady doctors in your hospital?
Ours being a corporate hospital, the measures are already in place. The posh committees are there, so any untoward incidents is always reported. Any untoward advances by a male counterpart or a female counterpart to the opposite sex is always reported. And we always do take such things, any such reports seriously. Uh, Going a step further, as doctors or as colleagues, we don't differentiate between our women colleagues and whether they be a nursing staff or colleague doctor or a junior doctor or senior doctor. Even for that matter, division of work is equally equal. It is gender neutral, and most of the time we try to make things as conducive as possible.
It was actually very good and encouraging to hear what he said. And lady doctors and nurses and all the ladies, please remember that unless you report what is happening to you, things will not be taken into account and you will not get the kind of protection. So be open, see that you are reporting if anything goes wrong, and there are people to help you out. I would like to take a different angle. Like, as I said, there is a lot of technology which we are seeing, and there is AI also, which has come into the medical field. What do you think, how AI is going to affect our medical setup, and how AI is affecting your particular field?
Definitely, I agree. AI is going to be a disruptive technology. It is going to disrupt a lot of previous beliefs. But I don't think it is going to replace doctors. That is not possible because human emotions cannot be replaced by anything. And by and large, medical society does not only deal with disease, it deals with emotions. Artificial intelligence might be of use. It is any tool is as good as the person handling it. So who is using AI and how he is using AI is more important. So particularly in our society where we have a lot of human resources problem, lot of shortage of skilled or educated manpower, it can be a boon actually. It can be used in rural areas where screening methods are not there, personnel for screening are not there. This AI technology can definitely be used. It is in fact is being used. We cannot say that it is going to stop medical practice altogether. It is not going to happen. When calculators came, we read in newspaper when calculators were introduced, even universities prohibited even mathematics graduates from using calculators because they thought it is going to. But now it has become a necessity. So that is how AI is going to become a necessity in future. And people who are able to use AI in a proper manner, they will definitely benefit from this. I think AI is going to be a very promising technology for medical science.
Yeah, so basically, any kind of repetitive or screening materials, AI can be effectively used, and they should be
There are
used.
many things. There are
They
many
should
things
be
which can be
used.
automated, like radiological reporting, finding
Exactly.
out some suspicious lesions, raising alarms on some data. These things can fairly well be done without help of any mankind using AI.
Now, let me ask you a very different question. If we compare cooking and surgery, what are the ingredients needed to get a great surgery or to have a great surgery?
Have you heard that adage, there are no secret ingredients? It comes from that movie Kung Fu Panda. Whole his life, whole his life, that Kung Fu was running for that scroll, and when he opened the scroll, it was empty. And then his father Po said, there are no secret ingredients. His soup is as good as anyone else's soup. So there are no secret ingredients. You have to keep life simple. You have to keep things simple. If you are disciplined, if you are hardworking, and if you are true to yourself, you don't have to be true to someone else. You are true to yourself. You will definitely succeed. So that applies for surgery also. That applies for cooking also. You have to keep it simple.
So keep life simple, basically. That is what you're trying
Definitely.
to say. Right.
Definitely.
Right. Your job requires pretty long hours of standing in the OT. So do you ever get that feeling that, I wish I get a break and I can go and have a cup of coffee?
See, sometimes the surgeries do stretch long hours. Sometimes it goes to 10 hours, 14 hours also. But it's not that we are not allowed to take breaks or we cannot. Surgery is not a one-man game. It's not that only one person is doing. There are two surgeons, two assistants, subsisters, anesthetist is there. So if required and if it is permitted, we do take breaks.
Absolutely. Yeah, because sometimes those breaks actually help you to revive yourself and do a better you get regenerated and do a better job. So, so sometimes those breaks becomes necessary for a surgeon also. If a teenager comes to you and says that, I want to become a surgeon or a doctor, what kind of advice will you give? Because nowadays, when in the news, we are hearing so many young doctors committing suicides because of the stress of the job and the stress of the studies while they are going through their studies. So what kind of advice would you give a young child when the person says that, I want to become a doctor?
No, if a young person comes, young teenager comes and asks me, I want to become a surgeon, I will definitely not discourage or dissuade her. I will definitely encourage him or her to take this field. I would just advise you, I'll give that you have to be ready for long innings. It is not I mean, how much glamorous it might look becoming a doctor or becoming a surgeon or becoming a cardiac surgeon or a kick-ass plastic surgeon. It takes its own toll on you. You have to try long hours, so they have to be ready. There are some unrealistic expectations, so those expectations should be avoided. Not only in medical profession, even before that, people nowadays we see a lot of young teenagers committing suicide because we make things life and death issues. It is not like that. There's life beyond becoming a doctor. There's life beyond becoming a politician. There's life beyond becoming a successful IT professional. There's life beyond becoming an entrepreneur. So there are a lot of things, alternative things which can be done. And this was said to me by one of the great, she is a neurosurgeon as well as neurophysician, Dr. Shari ma'am, during our graduation day. But all our life we keep on running behind our weaknesses. We should try to find our strengths and try to build upon them. So whatever your strength is, whatever our strength is, we have to find them and build upon them. So that no one can become stronger than that. And we should not make any issue as a life death issue. That if it is not there, life does not end there. That is what I would advise.
That's a fantastic advice because, working on your strengths and, obviously you will do much better in life. So, instead of running behind weaknesses, work on your strengths. So that, I think we should tell all the teenagers or young people that this is how to look for, this is how you look towards life. Okay. So now, doctor, if you are a surgeon, but suppose if you didn't become a surgeon, did you have any other aspirations or goals or any other careers in mind?
No, if given a second chance, I will definitely want to become a doctor again and a cardiac surgeon again. I have no remorse. There are you don't tick all the boxes at all the places. There are something lacking in every field. In some hours of frustration or some hours of dissatisfaction, so I might think I have not made enough money or I have not made enough things. But otherwise, I am totally happy being a doctor. I am happy being a cardiac surgeon. I will always do it another time. If I was not a doctor, actually, I had already taken admission in veterinary sciences. So if I was not a doctor, I would have been a veterinary sciences. But I know I would have tried to give my 100% into that also. So that is again what you asked in a previous question. What is my message to teenagers? So scoring 100% is not important. Giving your 100% is more important. Whatever you are doing, whichever field you are, if you are giving your 100%, if you have scored less and you think after the exam you could have tried better, then it is not right. But if you think you could not have tried better than this, then it is okay. Again, you have to make on your strengths, not on your weaknesses. So if you are giving your 100% to anything, you will definitely do good in that. I am being happy being a doctor.
Would you like to speak something about your family? Is your wife also a doctor?
Yes, my wife is a gynecologist. She practices in Delhi only. My family, my daughter is there. She is going to be 2 years old next month. My father, he's a businessman. Now he's not working. He used to run a small business in our native place. My mom is a homemaker. She takes care of us. I have two brothers. One is elder brother. He is an engineer. He is working in Visakhapatnam. Younger one is a bank official. He is a manager in Canara Bank. He is in Puri right now. In Delhi, I stay with my in-laws. My mother-in-law, she is a PhD herself. She used to teach. My sister-in-law stays with me. She is a PhD in law, and she also teaches. And my wife and my daughter is there.
So then you seem to be the first generation doctor in your family. So you must be the go-to person for anybody and everybody in the family having many medical issues.
Yes. I am the first generation doctor in my family, and a lot of people contact me with some problems. I'm happy. I'm blessed. I thank all my gods, all my teachers, and my parents that they have made me a able person, so that I am able to help them.
What is your goal in life?
I want goal in life is like develop a robust cardiac surgery training program in a place. All my life, I wanted to become a teacher in some medical college, like assistant professor. Unfortunately, that did not materialize. Things did not move in right direction. So one aim, unfulfilled aim, is that I want to develop a robust, because I'm a cardiac surgeon, I can teach only cardiac surgery. So I want to develop a robust cardiac surgery training program where younger generation can come and learn the trick of the trade.
What kind of hobbies do you have? I'm sure you need some, you do something in your free time. So what kind of hobbies do you have?
Hobbies means I read newspaper daily. I agree to some people will find that it always gives a crap, but the day I don't read newspaper, I feel something is missing. I spend a lot of time with my daughter as much as I can. In my free time, I try to read and learn something related to my field, and there are few new things I'm trying to learn. If I learn, I'll be able to tell more. I do listen to some music sometimes when I'm free. That is also a big stress buster. That is how I spend most of my time.
Wow. So then if you listen to music, then you're in the right place, like Mystic Chords Studios. And
Yes, definitely.
Absolutely. And what kind of music do you like to hear?
Again, I am little orthodox in that. I listen to all Hindi Bollywood music. I listen to ghazals and old songs. Most of the new songs which come to market, most of them I do not listen or don't remember them. Only few of them strike a chord with me. In my free time, I listen to Rafi Sahab, I listen to Mukesh, I listen to Kishore Kumar. Among the ghazal singers, I listen a lot to Mehndi Hasan, Fateh Khan, Ghulam Ali, and Jagjit Singh, of course. So this is how I spend my free time.
Do you have any particular song which you would like our director from Mystic Chords Studios, Miss Neha, to sing for you?
Okay, then one song from Mukesh, I remember, Kisi ki Muskurahaton pe ho Nisar.
Wow, that's
Kisi ka
a
dard mein
beautiful
sake
song.
So that song would be a great song.
Great. I'm sure Neha will sing that for you.
किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है, किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार। किसी को याद आएंगे, किसी के आंसुओं में मुस्कुराएंगे, कहेगा फूल हर कली से बार बार, जीना इसी का नाम है। किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है, जीना इसी का नाम है, जीना इसी का नाम है।
Okay, so now we are going to start with the rapid fire section. Heart surgery or heartwarming moments? What keeps you going?
Heart surgery.
What do you do to relax after a long day in the operating room?
Spend time with my family.
How would you describe yourself in 3 words?
I'm hardworking. I'm intelligent.
Okay.
I'm not so sincere.
What's the most common misconception people have about heart surgery?
One, it is painful. Second, that it is end of life. We go for surgery, it is going to kill me.
What is the most rewarding part of being a heart surgeon?
Patients coming back from a sickness and telling you thank you.
What's your go-to comfort food?
It's South Indian food, almost basically all South Indian dishes.
Coffee or tea? What fuels your day?
Coffee.
What's your favorite way of spending a weekend?
Again, spending time with family.
How do you define happiness?
If at the end of the day, if you are able to sleep well, keeping your conscience intact, that is a good day.
What quality in a person impresses you the most?
If a person is able to speak his mind on my face, I like that person.
What's the best gift or compliment you have ever received?
Gift, God has given me good family, that is the biggest gift.
A place you would like to travel but haven't yet?
Actually, there are 3 places, so 2 are remaining, Japan and any of the big cities of India.
And why Japan and why big city of USA?
Japan because I want to see their work culture, and USA probably because being born and brought up in Bihar, US has always been big.
One piece of advice you would like to give young medical students?
Advice to young medical students: they have to be sincere and have to be full of integrity. They will definitely be successful and also rich.
Successful and rich. Yeah, that's a good advice.
Yeah.
Okay, fine. So running on a treadmill or walking in a park?
Walking in a park, definitely.
Basically, you love nature.
Basically, it is better than treadmill, definitely.
Okay, that's a little bit of a controversial statement. If you can master a skill outside medicine, what would you like that to be?
Definitely singing.
Okay, so what kind of music do you like?
Basically, it is old music and dubbing.
Tell me something which has made you smile recently.
Playing with my daughter.
What about a patient coming and saying that, doctor, you're God?
Yeah, on professional front, patient coming and thanking me, I will make this one.
And that is something which is every day, so you're not really giving that importance?
It's not so frequent now. It used to be more frequent when we were in government hospitals, definitely. But yeah, it happens quite often.
What is the best compliment you have received in the last few years?
Yes, miss, when I was back in Chennai, people used to tell me, you don't look like a Bihari. I don't know whether it was meant to be a comment or compliment. I always look at it as a compliment.
But don't you always introduce yourself that you're a Bihari?
Yeah, I was born and brought up in Bihar. It became Jharkhand only after I left it. So yeah, I'm definitely a person from Bihar.
So that was your rapid fire round, and I think you have performed quite brilliantly. So how do you find this initiative of Mystic Chords Studios about these podcasts, And definitely, I'm sure that me being the host was one of the important things.
Definitely. It was a real pleasure talking to you. You asked a difficult question also with a big smile. And it made things a little easy. And I'm really happy and thankful for the initiative taken by Mystic Chords. We should always promote all the methods of spreading the right information. So there is a lot of misinformation about health also and other topics also. So it is good if we can do it with other fields of life also.
Yes. Separate the noise from the music, as you were saying.
Yes,
we are trying to give the music, as Mystic Chords Studios is also involved in music. So we are trying to give the music of health.
Thank you so
much for tuning in to this special episode of Mystic Talks with Mystic Chords. And remember, you can catch this episode and more on Spotify so that you can enjoy these incredible stories on the go. We are always on the lookout for unique and inspiring stories to share. If you or someone you know has a journey that the world needs to hear, reach out to us. You might just be our next guest. Until next time, stay inspired, stay connected, and don't forget to like, subscribe, and share this episode with everyone you know. See you in the next one.